All right, we're gonna get started. So, I'm supposed to do the welcome. Everybody, welcome to our January Provider Network, meeting. I'm gonna go really quickly of who's in the room on behalf of DDSN, because you can't see them. You can only see me. Quincy Swigert is here, our CFO. Lori Mangos. Associate State Director of Policy, who was just in the room, was Carolyn Benson, who was our interim general counsel, and Ann Dalton is at the end of the table. She's the Director of Quality Management. Right, Quality Management is next. We're gonna just go ahead and dive right into the agenda. Margaret, you're up first with our DHHS updates.
All right, great, thank you. Looks like a great and robust agenda, so I will keep my comments fairly limited. Did want to make mention that 2 memos have been issued as of last week addressing the retroactive rate increases for the cost of living. I believe Lori's going to speak a little bit more about the implementation piece of that, so I will not steal any of that thunder, but just know the memos have gone out. If anyone we directed these to executive directors of the boards, chief executive officers for DDSN contracted providers, as well as chief financial officers for DDSN contracted providers. If you did not receive it, please feel free to reach out to the Medicaid waiver mailbox, and we will be sure to reissue that. We're also directing questions on the memo based on the Medicaid waiver mailbox. So please direct any questions there. We're gathering those. If we see any trends and questions, then we can address those systematically. There was a separate memo that went out to early intervention providers. We really tried on the front end to minimize confusion of who it applies to and what services it applies to. So that was our intent there, to very direct communication. Again, questions, please feel free on the waiver services to direct those to the Medicaid waiver mailbox. And on the early intervention memo, we're asking questions to go to the BabyNet mailbox, and both of those are located in the memos themselves. A brief update, we have been working on the transition of ICF, community ICFs to direct billing. So we are looking at a later date than anticipated. So we are going to update the project with a date. We will not make July 1 based on some different factors, but we want to ensure that we implement this in the right way and with the right amount of testing, training, and advance notice. So we will be issuing an updated target date for completion of that project. It is still moving forward. We're just not going to be able, I think, to condense it in to make a July 1 date. Many of those processes are manual and a bit different than some of our other billing processes. So we want to ensure, again, that we implement it the right way with all adequate advanced information, testing, and training. We also met with some of the provider association representatives and their subject matter expert as it relates to the Technology First project. Got some good background and good information. We'll be, again, working collaboratively with the provider groups as well as DDSN as that progresses. But we appreciated that opportunity to hear from an expert that has done this type of implementation in other states. So that was welcomed information. We will continue our work moving that forward. I would also encourage for individuals that may not be signed up to automatically receive our Medicaid bulletins. There is a process through our website to ensure that you are signed up. We issued quite a number of bulletins related to state plan services and other coverage updates as of January 1. So we did make mention of updates that we have put into place. Some of those Again, just for awareness, we updated our coverage on cochlear implants to expand that coverage for ongoing services related to that for adults. We are implementing crisis stabilization in hospital settings. These are designated locations that are putting in place specialized units adjacent to their emergency departments for individuals that are in need of behavioral health focused crisis services to last no more than 3 days or 72 hours. Our hope is as these come online, they will be able to triage and identify appropriate resources to get the individuals in need of behavioral health services connected with those. We also are in the process of implementing at least one intensive in-home service on the behavioral health side. Again, this is mostly going to pertain to individuals that are involved with the DSS system and for youth, age 12 to 17, I believe. Multisystemic therapy is the name of it, but this is additional efforts around our total behavioral health approach to ensure that there are many different levels of services available. Very quickly, we have updated several manuals and will be issuing updates on nutritional counseling services, dietitian services, and then we will also, this may pertain to some case managers. We are going to be launching an updated manual or for our private therapies. These are, hello? Okay, these are our manuals that govern our occupational therapy, speech therapy, and physical therapy when delivered by therapists in clinic and office settings. So that's a pretty big manual update. We hope it's been revised for greater clarity and may pertain when you have questions that folks that are dually served. So wanted to make mention of that. Upcoming projects, you will be hearing additional information about our non-covered durable medical equipment project. This is a multi-phased project that is designed to put us in compliance with the home health final rule that essentially identifies that for states, they are not allowed to have a specific non-covered list of durable medical equipment, but they do have to provide a process and avenue for folks to request review for medical necessity for durable medical equipment. What this will mean for waiver participants would be some shift in how certain equipment is requested through the state plan versus through the waiver. So we are in the midst of developing training materials as well as policy statements to assist all case managers that will experience some change in our durable medical equipment policy. So that will be forthcoming in the near future. Have a host of other items that are tied in with our budget request and a July 1 initiative, so I won't go into great detail there. But again, if you are not signed up for all of our Medicaid bulletins, that's our primary way of communicating these changes. Please ensure that you do so. With that, those were my main points. Constance, I will turn it back over to you.
Thank you, Margaret. Margaret, are you going to stay on? I don't know how we normally do it. Do we?
Yeah, she's typically stays on for the whole meeting.
Do we wait for questions all the way at the end, or?
Let me talk about the rate increases real briefly, and then if they have questions, we can pause for a second. And are you planning to stay for the whole meeting, Margaret, or you got to go?
Yes, I'm planning to stay on.
For the rate increase implementation, we are approaching it the same way that we did last year. This year, there will be a TheraP implementation with a rate migration on the authorizations effective March 1st. And then HHS will go in and do a provider level adjustment from 7/1 to February 29th, where you had billed the old rate through TheraP. The state funded rates will mirror the new Medicaid rates that were published. So if you have anybody getting state funded residential, state funded day services, any of those, our state funded rates will be updated, and we will do it the same way. Like, we will do your adjustment 7/1 to 2/29. The new also be updated with 3/1. That'll happen for any of those. For EI, the EI 3 to 6, we will mirror the published BabyNet rate, which is what we did last year. So you will get that published BabyNet rate beginning 7/1. We will do it the same way, right? We'll do an adjustment. The new invoices will be updated for the March billings. All right, I don't see any questions on my end. If anybody has any questions, they want to unmute.
When would they do the look back? In March?
When will they do the look back for the rate? So Margaret, you guys did it a few times last year. I think, I don't know what the first date was that they pulled it. Do you know?
I am not sure, but I believe we would want to ensure that all of the TheraP actions have taken place, and we try to get it in one run if at all possible. So I would anticipate that we will be around the March timeframe when all of those TheraP authorizations have migrated. All those processes have happened.
And we're going to try to mirror their process as much as possible so that you're not trying to figure, so kind of when they do their run, we'll do our state funded sweep. Dana, did you have a question?
Yes, so I just put it in the chat. Were there any increases in the state-funded case management rates?
No, the state-funded case management rate mirrors the MTCM rate, and the MTCM rate was not updated.
Okay, thank you. Do you know if that is going to be addressed or looked at with all the other rates?
Margaret, you want to talk about the MTCM rate work? Or?
Yeah, it traditionally has not been included with the proviso requirements for adjustment. We have not addressed any change to the rate with MTCM. I do see a question in terms of ICF rates. We will be coordinating with DDSN for those updates in terms of ICFs.
On state-funded case management, I'm just curious, when DDSN gets its allocation, those funds go directly to DDSN, do they not?
I'm not sure what you're asking.
Rather than going to Health and Human Services, do the state-funded case management funds go to?
The state-funded case management wouldn't go to Medicaid because it's not a Medicaid billable service.
Right.
But
so
most of, I'm not sure, like when you say state-funded case management, do you mean only totally state-funded case management, or do you mean state-funded case management and MTCM, all non-waiver case management?
No, I'm talking about just state-funded case management. Right. I thought went
it would go
to your allocation.
Right. As well as the match for MTCM, because we're still the provider of record.
So I'm just a little confused about when the state appropriates money for these raises that are going into the waiver, the individuals that are included, and are the individuals, would all case managers be included in what goes in to determine how much the state legislature appropriates? If they are, then a piece of that somehow is getting missing by it not going into either of these, although I understand your situation, Margaret, because you have a lot of different people doing MTCM for which you did not receive an allocation. However, the case is not the same for DHA, for
Yeah,
DDSN.
so just a couple of general observations, and Quincy, you might speak to this a little more than me. I'm not sure that I'm not sure how the allocation's done, right? So I don't know if it comes off FTEs. We wouldn't be reporting the case managers
We
within.
didn't get appropriated any money based on that proviso.
Right.
All the money for that proviso went to DHHS because they farm it out. So we did not get appropriated any money for state-funded case managers.
Okay.
So all the FTEs that you put in your FTE report when you sent to HHS, that's what they use to send to the executive budget office when they do their calculation.
So in other words, that
allocations.
portion, Margaret, may have been then, if you take all case managers, it may be spread across the case management waiver. The entire amount is spread across case management waiver, so it wouldn't be a shortfall for us. That's my question. In other words, do we have, we spend a lot of time on some of these other things that we have had to give people raises for, but yet the rate we received hasn't been increased to help us pay the rates. Okay? Like any time that somebody spends doing state-funded case management, our costs went up over 5%, because of the raises. However, our income's not going up. So, if you had somebody just doing state-funded case management, you'd really be at a loss year after year after year, having to pay for these increases and not, I think MTCM hasn't had an increase in 5 years.
More than that.
More than that.
I think that market rate was developed in, I think, 2014. I don't think it's changed
It's
since
been a
then.
long time.
Yeah.
But
It was.
The lump sum spread over the waiver. Is it spread over the waiver? If it is, then the money should be there. If those individuals went in at 100%.
So you guys are the ones that filled out the FTE reports, right? And I'm not aware of anybody that has a case manager that only does state funded. Maybe
there aren't. I was just saying that for example, but it's a piece of a lot of people.
But when you reported FTEs to them around waiver case management, did you say?
100%.
Right.
That's why I'm thinking it may not be such a problem as I'm thinking it could be, because those funds may have just been spread across the waiver, so they're getting really more for the waiver, which helps compensate the agency anyway for the raises they've been mandated to give people providing the other services. Does that make any sense? And Margaret, do you know if the total is spread across the waiver?
I'd be glad to take that question back to our team in terms of that. We traditionally have not included MTCM in these rate adjustments. As you indicated, we pay multiple entities for MTCM outside of the waiver and outside of DDSN. But I'll be glad to take that question back.
But if it was spread across the waiver, the 100% of those funds received, then it's not really a problem because you're still getting it. So I'm not saying it's a problem. I would be interested in how that flows, because we turned them in as full units. As full FTEs. And it varies by person, actually.
Yeah. Margaret, there's a couple questions on here for you around the name of the behavioral health service you were speaking about and the ICF rates.
Sure. So for behavioral health, we did implement an intensive in-home service, evidence-based service called multisystemic therapy. It has a prescribed range of individuals for whom it is appropriate. For youth, I believe 12 to 17. It has been delivered already with an existing provider network, primarily through DSS. But it is added to our rehabilitative behavioral health services manual and has a full description there. So MST, multisystemic therapy, was the evidence-based practice that we have implemented on the BH side. In terms of ICF rates, we will be communicating to DDSN those rate changes for ICFs, and a similar process as we have done in years past with any adjustments to ICF rates. We are just getting that information over to DDSN as the current provider of record for the ICF rates.
A question about the ICFs also. Will the ICFs, when you do this transition to direct billing for the ICFs, is that going to occur simultaneously with the designated rate for the individual facilities?
Ralph, that's
right now there's a rate, just a rate, but there has been talk about them being individualized.
Yeah, that would be part of that project, an evaluation of individual rates versus statewide rates. So that is a required part of that project.
Okay, that's what I was thinking. That's a big piece. Thank you.
Margaret. Margaret, can you hear me?
Yes.
Yes.
Okay,
Yes.
sorry. Margaret, I was just curious, going back to the crisis stabilization with the hospitals that y'all they're putting together, is there a list of those hospital systems that are going in on that piece with the crisis stabilization out there that we know about currently?
I will check on that, Ryan. There are specific hospitals that we expect to be in different phases of development. The department issued a series of infrastructure grants that were authorized through a proviso last year to allow for payment of funds for specific hospitals. I believe it's 13 that can use the grant funds for building the infrastructure for those specialized units. So it will be those hospitals that have received grants for infrastructure, and they are in different phases of readiness. So not all are going to come online immediately, but I'd be glad to gather some additional information for those hospitals.
Thank you.
You're welcome.
All right. So I wanted to give everyone an update on the provider applications, provider qualifications process. To date, we have received 25 applications. Many are for early intervention providers, and unfortunately, most of the applications that we have received have not been complete. It is important for the applicants to be sure that they respond to all areas of the application, so not just the attachments. It's important to make sure that they recognize all of the different areas where they need to provide information. Partial applications are not accepted, so the provider or the applicant is getting a letter stating that they need to resubmit with a full application. So we don't have any new applicants that have been fully approved at this point. They're still somewhere in the midst of that process. For Alliant reviews, I know that the provider network has received a memo. DDSN has entered into a new contract with Alliant after posting the request for proposal last summer. With the new contract, there are changes to the provider notification process for the administrative compliance and individual service reviews, as well as the licensing reviews. The review cycles are on a tighter schedule now, from the initial notification to the receipt of the provider's report of findings. So instead of waiting an extended period of time to get your feedback on the review, you should have that information much faster at this point. We sped up the timeframes all the way around. So this should help improve the overall flow of information, as well as facilitating more timely remediation of any corrections that are needed. It is important for Alliant to have a reliable contact for each provider, particularly for the residential and day program managers, as well as the executive directors. We want to make sure that providers have their notification at the earliest possible time, and avoid any delays in getting that information. We're recommending that providers have a single cell phone that could receive text notifications, because I know for a lot of people, you're more likely to read a text a little faster than you might read your email or listen to a voicemail. So that's just an idea for you guys to consider. But please make sure that Alliant has your most up-to-date contact information. Regarding the incident management reports.
Hello, this is Jerry.
Yes.
I'm just curious, what was the rationale for changing the time and making it harder for providers to comply because you moved the time frame? I mean, has there been a history of issues? I mean, I'm just curious why that was changed from last time.
So there are a couple of issues. Number one, it's a new RFP. So in our negotiation process of saying what we wanted and what our vendors could potentially offer us, there was a negotiation there on time frames, particularly when it comes to speeding up the reports of findings. Also, we do have an issue, not with all providers, but with many, where the state of the setting, the condition of the setting on the day of a licensing visit with advanced notice appears much different than on any other day of the year. So we're trying to make it more of a review as a day in the life of that provider agency and the participants, to show a real picture of what's going on at any time within the facility. We don't want to see what's been dressed up for the licensing review. We want to see what the services are really like. And, you know, we've had a couple weeks behind us at this point. There have certainly been some rocky times, but I think that overall providers have adjusted. They have made arrangements to have someone available. Alliant has allowed a little grace as we are transitioning into this process, but they are on a schedule. So, you know, if no one's there, they're going to keep moving.
There's one issue that I've heard. Of course, we don't operate SLP2s, but I thought it should be brought up. That has to do with SLP2s, the tenants having leases, and notice to be given to those individuals. Could they not have been treated like the CTH ones?
That's something that we can consider. They do have to make the apartment available for fire marshal and other inspections, but we'll consider that.
You know, where you give them the 24-hour notice.
It's kind of,
yeah.
Are there any other questions about licensing?
Well, the change, only thing I would say, that change was made before the notice came out to the provider network. So
And Alliant allowed grace. I mean, they didn't mark anyone as non-compliant during that 2-week period.
Hey, this is Jason. Can you hear me?
Yes.
You know, on the 2-hour notice, you know, if we're at a doctor's appointment or we've got other things going on, what actually happens if we're not available? I know we're 2 weeks in and providers are working. We were last week. We worked with you guys well, but if I can't for an honest reason, how do we document that? What happens then? Because it's going to happen. There's just too much going on during the day.
There is likely someone in your agency that can make arrangements to be there. You know, I know people don't like to hear it, but we stress be review ready at all times. Whether it's someone that works in your maintenance department, it could be an admin. It does not have to be a program person that shows up to allow access to that setting. It can be anyone, as long as they can open the door and point the reviewer to where the books are located, it's fine. Again, we've had many situations where the house looked very different on the day of the licensing review versus an unannounced visit that might have occurred at a different time of the year.
Has that been true since you or you don't know yet from the reviews that have just been conducted?
I can't really comment on that. We're within that, couple of weeks, so I haven't actually seen those reports of findings just
That'll
yet.
be interesting. If they're not that different, then.
I can tell you that within the last 2 weeks, we have had staff members from quality management that have done unannounced visits at locations, and the homes looked very different from what was recorded in their licensing review a couple of months ago.
So I got a follow-up question, if I may. Are there any plans to initiate the same level of reviews within your own programs? Or is this just for the provider group?
I'm not sure if I understand your question. If you're talking about the ICFs, they do get unannounced visits from DHEC. If you're talking about the autism division homes, they are subject to the same level of review as any other DDSN provider.
Okay, thank you.
Okay, so for the incident management reports, please be mindful of returned reports that are coming back for clarity and content. We have noticed that some providers have been taking several weeks to resubmit their reports with the requested information. As I've mentioned in some prior meetings, DDSN has performance measures associated with each of the waivers that we operate. And those performance measures include timely initial reporting and final reports, as well as documentation of remediation. When DDSN or its providers fall behind in those performance measures, a plan of correction is required to detail how that provider will come into compliance. So I just want to reiterate that the administrative review must include a summary of the review process and the information that was gathered at that time. It must ultimately stand on its own. So we want to make sure the reports are complete and that the supporting documentation has been attached. If there is documentation in THERAP, it is okay for you to reference the GER as the document that is related, but you still need to tell us something happened. Our incident management staff are not going to routinely go out and search GERs. They're not going to search the case manager's service notes without being directed that there is a document there. So we want to make sure that the reports are complete, that they stand on their own. It is not okay to simply list the documents in lieu of completing the administrative review. Please don't submit a report and say, see attached documents. Please don't submit a report and say, we conducted a review, please see the case manager's notes. When that happens, you're basically inviting a third-party review to have access to that documentation. So we want to make sure that the file stands on its own. With medical documentation, as residential providers in particular, you should have access to the medical documentation to support the person. DDSN is not going to request that medical documentation from the doctor's office. We will expect the service provider to have that and to upload it if it's needed to support the critical incident or the allegation of abuse, neglect, or exploitation. Any questions there? All right. National Core Indicator surveys are gearing up at this time. This year, the USC Center for Disability Resources will be completing the National Core Indicator surveys, so that's a change from prior years. Look for information about your agency's sample and the schedule from CDR in the coming week. We will continue to pay providers for their participation, similar to what we have done in prior years. And the last thing that I'll mention is that there's information that was shared with the meeting agenda today that includes information about training available from Intellectability regarding the Fatal Five. We've had a lot of choking incidents and Fatal Five related issues. So this is great training for our provider staff. In addition, there is information on dementia, a dementia one-on-one training that's been offered by the Department on Aging, as well as a series of 9 free seminars that are available from CQL. There's one per month for the next 9 months. So I hope that providers will take advantage of that training. In addition, I wanted to mention that we continue to work on a learning management system-based curriculum for medication technician training. That will be the classroom-based portion of that training. And we are working on a learning management system training for abuse, neglect, and exploitation. That will include scenarios as well as a knowledge test that will be built into the different modules. So that is forthcoming and should be available by the summer. Any questions?
When's the medication? Summer too?
I
was hoping.
I'm hearing the next couple of months. I'm going to say summer to be safe.
Okay. Like somebody had told us December, January, so that's why.
Yeah, they're very close. They're in the quality assurance stages of the training.
Will the A&E training take place of the comprehensive test that we already doing?
Yes,
Okay.
it will. And it's not required. It's there if providers want to use it.
Excuse me, Ann, can you hear me?
Yes.
What was the reason for the lack of notification from DDSN with the Alliant notification? You guys sent a memo out and it was implemented by that Monday. So is this the communication style that we can expect going forward?
I don't think it's necessarily the communication style to expect going forward. I think there were a number of factors there. One had to do with the negotiation of the new contract with our vendor, working through MMO and setting up the process for the reviews, working through both the vendor agency and DDSN to determine what we were willing to do and what they were willing to do. You also had the holidays in there that impacted some of that scheduling and communication. And again, I will reiterate that we did allow grace with the providers that had a review prior to the official notification going out. There was, there was no consequence in terms of non-compliance or any negative review effect based on that notification.
Okay, thanks.
So we have one question about the status of the assessment tool for determining level of support needs, the EdMetric. I think another solicitation has gone out. Is that correct? Do you remember?
For the implementation or the pilot, yes.
Yeah. So there's a solicitation out for the implementation of the pilot. And once we get that and the panel reviews it, then that'll happen.
I'll go through that process.
Yep. That's the only question I had.
You done? All right, I'm done. So I have the pleasure of talking about BCG and pending legislation. I think everybody in the room and online is aware of the BCG study. I saw a lot of you in attendance last week. I attended that hearing virtually because I had already previously heard what the presentation would be. I want to make sure everyone understands. So the Boston Consulting Group was hired by the Department of Admin to conduct a study pursuant to Act 60. They have issued thus far two parts of their analysis. It's my understanding from the meeting that they had with all the directors, my weeks are running together, I believe it was the first week in January, that the report that currently stands is not the final report. There will be a final report that will be issued on or before April 1st of this year. Is my estimation that that report will be out probably within at least the next month or so. I didn't get any indication from them that they're gonna issue that report in April. I think it'll come out sooner than later. As a result of that study, there has been a bill introduced, Senate Bill 915. There are two meetings in regards to that bill this week. The first meeting being on Wednesday at 10:30. There will be another part two. The subcommittee of medical affairs will take testimony from BCG. It's my understanding that there will be no testimony from any other parties. There won't be an opportunity for any other parties to ask any questions. That will be the time for the senators, now they've had a time to digest the report that was given, they'll ask BCG questions. That following day on Thursday, there will be the full Senate Medical Affairs Committee, and they will take up Bill 915. I understand from the coalition meeting last week, there were some concerns about some inaccuracies in the report. If you guys could email us those inaccuracies, we plan to point out any inaccurate. Now, keep in mind, all we can do is bring it to their attention. Ultimately, this is BCG's report. Whether they change it or not, it's on them, but I think it's important that when we see things that need to be corrected, we let them know that the way you have this formatted or the way you explain this process is incorrect. And they've been very open to feedback, so we plan to give them as much feedback as they keep the doors open. I don't think there's any, we're learning as you guys are learning. The process is moving very quickly. When we know information, if you want a copy of the report, or if you guys want to contact BCG yourself, I'll have Christy send out the contact information for their rep. I didn't ask before, so I want to make sure she's okay with that. I imagine she is. So you guys don't have to use us as the middleman. You can go directly to the source. And I encourage you, if you have any questions or concerns, to reach out to them directly. Anybody got any questions that I can answer in regards to BCG's study and the Senate bill?
It's my understanding that it would be a phase-in if it passes. I mean, everything wouldn't take place
I would hope
July
not,
1st.
because
It's
I don't know.
impossible.
Yeah, I don't know
Just the
logistically
computers.
how that would help, how that would work. So keep in mind also, in between this study going, there's also a move that's going to transpire. We're going to be moving to a new location. So you have the logistics and all of that goes into that, the money, the trying to figure out who moves first, who moves where. That'll be taking place in as early as July. If it gets funded. It has to get funded by the General Assembly, July 1st of 2024. And so the idea that they would be moving us and restructuring us and all of that would take place quickly. Now, I imagine this will be phases. I know the move will be phases because we've already been told that. In regards to the restructure, it would have to be phases for it to work. Ryan, I think you had a question?
Constance, that's what I was going to ask about the property itself. Has that already been solidified at this point? But you said it has not. The funding hasn't been.
So what I was told, and I got dragged to a meeting about the building. I don't know when that was. Was that this year? I think it was. Then we went about the building, and then we went about the restructuring. That is done as far as department admins is concerned. The only thing that could cause a wrinkle is if it's not funded by the General Assembly. I asked, because I'm one of those people, I asked, what's the odds of it not being funded with all the time and energy and work? And they said it was slim to none. So everybody's operating under the premise that that will be funded on July 1st. Most of the work in regards to department admins functions that need to be done to facilitate this move has already been done. They have already drafted the documents. They're just waiting until the General Assembly funds it to actually put the solicitations out, and that type of thing. But they've done all of the legwork.
If we have comments to you on the BCG report inaccuracies, to whom should those be sent?
I think, so the person that they have me contacting, she is an employee of the department admin. I'm gonna email her and ask her if you guys have concerns or comment, should those emails go to her, or do they want them to go to a BCG rep?
Or
and then I'll have Christy.
Should we also send them, would it be you directly as far as if we send them to DDSN?
Yeah, you can send them to me directly. I anticipate I will see some of you guys this week I'm gonna be honest with you, if they have a virtual option, I opt for the virtual option, because I driving to that state house and parking in the parking garage gives me anxiety, so I do the virtual option when I can. Any other questions about BCG and Senate Bill 915? All right, I'm gonna turn it over to Carolyn, who's gonna give an update about the background check.
Yes, I'm giving a brief update regarding the background check directive. So at the end of December 2023, we did receive the Attorney General's opinion regarding some questions that we had posed to them. And then just last week, we met with SLED to discuss background checks even further. Currently, we're reviewing the directive and we're taking into consideration the AG's opinion as well as our meeting last week with SLED. We understand that the providers would like to provide some input or have some comments. And so we're going to put together a focus group. So Lori's going to help me put that together, and she'll be reaching out to all of you to find out if you have representatives that you want to participate.
Yeah, I will likely use the same vehicle. I'll contact both provider associations and ask for maybe 3 representatives from each so that we can have a small group after we've had a chance to digest both opinions and do some work on the policy, and then we'll bring you in and kind of get some information from you so you can help us along.
Yep.
I did also want to mention in regards to, we are aware of the issues with Identigo. We've also made MMO aware of those issues. We're not the only state agency that are experiencing those issues. So MMO is aware of it and is actively seeking a solution to the problem. Right now, Identigo is the only background company that we have on state contract. So they're who we have to use for the time being. But MMO is aware of it. I think they painfully aware of it. They're like, yeah, we know about Identigo. And they're actively working on trying to find a solution. Any questions?
I know all the providers appreciate anything that can be done with speeding up that process.
Yeah, and that's what we've been expressing to them, that what we're trying to do is balance what we legally have to do and make the process easier for everybody.
Because you said, or somebody said previously, different departments have interpreted it different ways. I am curious, since you got the letter from the Attorney General, though.
We can send it to you. It's not like a yes or a no, but we will send it to you.
It's a bunch of lawyers, so you're never going to.
It is a lot. It's a lot of stuff, so, yeah.
But we'll circulate a copy of it. We got it. And
That's good.
the meeting we didn't get like a formal written issued opinion from SLED, but we had a 2-hour meeting with them. We got the gist of where they're going. So, and then once they have advised us that once we draft our directive, once we, DDSN Central Office, we have the provider group, and we agree, we have to send it back to SLED for them to look at it before we can finalize it. So
at that point, it would go to the commission.
Yeah. Well, so what we're going to do is involve y'all as far as a focus group before it gets to that point of public comment, right? So we're gonna bring in some representatives to help us with the draft. We'll draft it, we'll send it a SLID. When they agree on it, then it'll go out, it'll still go out formally for public comment. But we're just trying to kind of pull you in on the front end, because when you see the opinion and then we talk about kind of where the SLID opinion is going, we're gonna have to try to be as creative as we can to do what we can to make it work within our system, right? That's really where we are, so.
Any questions about the background check? All right, Quincy, you're up.
All right, so the first thing is the annual reports. I just wanted to inform the boards that DDSN has compiled an annual report, which does include information on DSN boards. We used 2023 data, and we plan to publish this report in the next few weeks. But before publishing, we wanted to give DSN boards an opportunity to review the information that's contained in the report. So we're asking you to review and send back a response to any information that may need to be updated. This email will contain 2 pages of information for each DSN board. One page contains like programmatic data, and the other is financial data. So to give you a quick example, there's a section that has board member names, and what DDSN included in the report may not reflect the most up-to-date information. Is there a question?
No, it's just some.
Oh, okay, sorry.
I got it.
Sorry. So we just want to make sure, I don't know if I got that last line out, but the report may reflect not the most up-to-date information when it comes to like your county board members. So
when you say 2023,
yes,
fiscal year 2023.
well, the financial data was put together as a summary of your financial statements that were issued. The programmatic data was more calendar year data. So it's like there's a page of programmatic data and then there's a page of financial data. We tried to distinguish between the 2 dates, what's calendar year and what's fiscal year. So so we're going to send that email out to you hopefully this week, and we'll ask for your response, and we'll have all the details in there. Or DSN board, just does not include private providers. My second update is...
The question is, who will it go to? You'll send it to EDs?
I'll send it to EDs, the executive directors, yep.
It'll probably come from.
It'll probably come from communications.
It'll come from communications on behalf of me. Yeah, so it won't be an email from Quincy himself.
Yeah.
It'll be from communications.
And so if there's no other questions, I'll go to the second update.
How will that be used? How will that be used? You're going to issue a report. It's going to be posted on your website, I would
It'll be
assume.
posted on the website. It'll go to the agency stakeholders. It'll go to the boards. So all that will be printed and published and sent to the executive director, and the board chair will get hard copies, and I think the rest will be soft copies. So, yeah. The next update is around the new fiscal agent contract. As we communicated before the holidays, DDSN is transitioning to a new fiscal agent for participant-directed services. The new vendor, Morning Sun Financial, is going to be the vendor responsible for processing payrolls, withholding taxes, and issuing annual W-2s for all DDSN self-directed service programs. We sent out an executive memo, I think it was maybe around the 20th of December. We informed executive directors, case managers, and case manager supervisors of this transition. Morning Sun has already held 2 virtual sessions, as well as an in-person group meeting in the Horry County and Florence County areas for the first wave of transition. The second in-person meeting is slated to be held in the upstate the week of February 7th through the 9th. And then the Columbia area is scheduled for March 5th through the 7th. And Charleston, Somerville area is April 9th through the 11th. Morning Sun is also staging the mailing of the participant and employer packets as these transitions will take place over the next several months. Executive directors, CEOs, as well as case management supervisors, we've sent them the email, but you guys may be getting calls if you're a case manager from your participants. There's, I think Morning Sun has put some information on their webpage. They've recorded some of the in-person trainings, and
Morning Sun will also be present
Yes.
for the first 30 minutes of the case management work group meeting this Wednesday. Is that when the case management work group is? I think it is. So encourage anybody to attend that meeting. Any case managers, typically case management staff don't attend, just the, so if you want to have your case managers listen in to that 30-minute session, it might be good. They're just going to.
Is that the first of the session?
Yes, it'll be at the first of the case management work group at 10 o'clock. And so they're going to do just a brief presentation about themselves. We tried to send some information out to case managers to let them know kind of the workflow of this, because it's not a hard stop and start. Like Quincy said, it's going to be a staged process where we do groups at a time. We're going to handle the authorization shifts at this level, right? So that case managers are not getting super confused, because the authorization shift happens at paperwork completion. So Morning Sun's actually working with my office to say these people are ready, and we'll come up with a transition date, and then we'll let the case manager know, hey, the transition date is this, your authorization's been updated, right? So that we're not trying to run down a bunch of case managers to make sure that the authorizations get done timely. So hopefully it'll minimize. The thing I want case managers to be focused on is questions, right? Because we have learned through these first couple of sessions that there's a lot of confusion out there, you know.
Lori, hey, it's Michelle. Let me just make sure I'm hearing you correctly. This is where the switch is going over from where it was, like Charles Lee, this is to this new program.
Correct.
What about providers that do their own respite still?
No change.
Okay, and then one other thing, March 5th through 7th, the HSP conference. It's going to be a lot of providers. That is the tail end of that. So just as a scheduling thing.
we'll say that back. We have a weekly meeting with Morning Sun, and so we can talk.
So what's going on? What's our concern with the 5th through 7th?
They'll be.
The HSP conference is in Charleston, and 2/3 of the providers will be in Charleston.
So you're saying it might be helpful to have them come there, or are you saying?
No, I'm saying that it's going to be maybe a scheduling conflict if there's going to be providers that need to be at these meetings on the 5th through the 7th.
No,
They don't.
Yeah, these providers.
These meetings are already happening, and they're just happening like with the actual workers.
Okay.
So it's really a
Sure.
paperwork thing where we're trying to shift the EINs and the employment paperwork and the payment. It's really kind of focused to, we're not even present at these, right? We offered to be there and they were like, no, we really don't need you there. So it's just, they're sending out directed information to the workers and the families or people who are self-directing. And they're meeting with them individually, because it's not really a service provider change or anything like that. It's a change of who's writing the check.
If there's no other questions, that's all I have.
Well, we have a section here for any other questions, additional remarks. I think our next meeting is, what date is it?
So there's a couple of questions. Let's go to those first. There's a question related to the fiscal agent and how it ties into EVB. I think the answer to that is our goal is to jointly issue, I'm gonna let you say it because I'm gonna say it wrong.
Yeah, at the end of this whole goal, we hope to do EVV and fiscal agent with the new RFP that goes out.
Jointly with HHS.
Jointly with HHS,
Right.
do like a multi-agency solicitation.
Yeah.
That's what we're hoping, but EVV, that's still an ongoing thing, so, once we get that implemented, then we'll know more about the fiscal agent side.
Right. The other thing is, the question is, can you share the plan going forward about monthly commission meetings?
What does that mean, the plan? We're gonna plan to have them? Yes. So January, we did not have a commission meeting in January because we didn't have anything that we thought necessary to take up. Also, myself and the general counsel were out of town for a conference. But most importantly, we didn't feel like there was anything that we needed to take up. We will be having a meeting in February. There's a lot has just transpired within a couple days that we've been back. So that will be our plan going forward. But we don't just arbitrarily decide to cancel meetings. What we do is we talk first, I go to the executive staff and say, get with your people, find out if there's anything that needs to be taken up before the commission. And then I have a conversation with the chairman of the commission, and we discuss it thoroughly, and then we make a decision from there. Based on those two pieces of information, this month, we decided that we were going to cancel. But we will definitely have one in February.
All right, I think one other thing I'll say really quickly is we did have a comment about these meetings that are typically at 2:00. This week, we had to move it back to 3, being too late in the day for some people who might want to travel, because now that we've opened it up to anytime you want to come in person, right? So when we will have the February meeting on the normally scheduled Monday, right, which is the Monday after the commission meeting. I don't know what date that is right now. But we will try to move that time up a bit from 2 so that people who want to travel and be here in the middle of the day can be. So maybe 11 or we have to look at that day, but we'll try to come up with a better time because we heard you guys loud and clear that it was a little too late in the day.
The next meeting is scheduled for Tuesday, February 20th. And I think it's because the 19th is a state holiday.
Oh, okay. So Tuesday, February 20th. And we'll try to have it earlier than 2, right? Even if it has to be 1, that'll at least give you a little bit of time where people can travel.
All right, thank you, everybody.
Thanks, guys.
Thank you.